Hi, so we wanted to create a podcast with the theme of emotional wellbeing for our staff here at St Bart's Hospital. And we thought probably the best way to do that was to have a bit of a reflecting team made up of different professionals, where we're really just exploring the different themes of different issues that might be causing anxiety for staff at this time. My name's Vicky Kelly and I'm a consultant clinical psychologist here.
I'm Michael Splain, one of the radiographers in the cath labs.
And I'm Mark Horton, I'm one of the senior charge nurses in the cath lab.
I'm Holly Dorr, I'm one of the cardiac physiologists here at Bart's, based in the cath lab and the pacemaker clinic predominantly.
I'm Fizza Chowdhury, I'm one of the interventional registrars here at Bart's Hospital.
I think from being in the lab today and on the shop floor and speaking to all disciplines of staff, I think one of the main causes of concern at the moment is redeployment. It seems to be quite an emotive subject and quite understandably so. I mean, for example, the nursing staff are being deployed from the cath lab and the cardiology floor to an intensive care, which is in itself stressful. But when you've never worked in that environment before and now you're being asked to go to intensive care, it's causing a lot of anxiety amongst the nurses. And I believe that other disciplines are also being asked to being told to redeploy to other areas. So I think maybe that could be number one on our discussion.
Yeah, absolutely. I think staff are facing really kind of valid, understandable fears and concerns at the moment about redeployment. So there might be very experienced cath lab or clinical nurse specialist nurses who are being asked to go and work on intensive care, and they might not have done that for 10 or 12 years. They might not have done a night shift for that long. They might have got used to a different style of working, and understandably might be really concerned, in spite of being very experienced nurses, about the kind of having to do all of those tasks again, and also just the impact on their family lives if they have children at home and they're suddenly being asked to do night shifts where they might have been more and working weekends where they might have been more used to working Monday to Friday 9 to 5. That can also be a concern. And we were talking earlier about the importance for staff to have these concerns validated and heard by their senior colleagues, and for the impact that it will cause on their own lives, recognised and acknowledged. From a psychological point of view, I think that people's value systems might come into conflict here, because I think most people in the healthcare system as a whole want to care for people and do their very best for people, and that might be a strong value that they hold, but they might also have strong values about keeping their family life as normal as possible and engaging in other activities with friends and family at home. So that those two might come into conflict when they're being asked to redeploy to these roles.
Yeah, I think one of the things that I've heard from a few members of staff who are being asked to redeploy is almost a sense of wanting to help, but there being perhaps a sense of guilt that they don't want to, perhaps, or that they're nervous or worried or don't want to do a job that isn't the job that they actually signed up for, and sort of feeling a little bit of shame about actually feeling confident to say, actually I don't want to do this. I will do it, and I'm going to do everything I can to help, but I don't want to. Yeah. Which I think is quite a normal, natural feeling, but I think it's understandable there's a little bit of perhaps guilt around that people might have. Absolutely.
And like with a lot of other things in this new COVID environment, there's a lot of, they might fear kind of social stigma for not kind of mucking in and doing that whilst also feeling very, very frightened. So I think you're absolutely right. It's really normal and understandable to feel all those feelings, the sort of anxiety first of all, and then the guilt for not really wanting to do it. And I think we need really to be supporting staff in these areas to do this kind of work, and for their leaders to sort of acknowledge what a task they're asking, and to think about what changes and what training they might need and what support they can have to be able to do this kind of work.
Because I think, Mark, you were saying that it's quite daunting to have to suddenly upskill to something you may have done before, but actually within hours you have to go to ITU now. And I think that's happened, hasn't it?
It has happened, and personally, I in the past, I previously worked in intensive care for over 10 years. But over the weekend, when I was thinking of having to come back and look after, which is potentially going to be quite a very sick patient on a ventilator, ventilators have changed so much in my 12 plus years of absence from intensive care. The thought of it was actually quite scary. And then at present, I'm not going to be redeployed because being a senior charge nurse, and of course we're having depleting numbers of cath lab nurses being redeployed, so we are staying where we are. But then, of course, my thoughts went to my junior colleagues who have never done this before, so it must be really scary. And also, traditionally, in intensive care, it's an intensive care nurse and one ventilated patient. And now that ratio has been turned on its head. You're looking at, I think, the possibility of having one intensive care nurse and 2 other nurses looking after a group of patients which will be ventilated. So it's quite a different, unprecedented situation that is in itself scary.
Can I ask what sorts of things you would find helpful if you were in that situation, just so for other staff who might be welcoming redeployed staff into their areas can consider what kind of things would be helpful in that scenario in terms of how you would feel more supported to do that kind of work?
Personally, I would feel, well, number one is that you're going to be supported.
Yeah.
B, not being put in a position of sole responsibility for that patient.
Yeah.
Because obviously it's going to take a while to upskill to such a different level.
Yeah.
And of course you want the area you're going to be moving to be welcoming and friendly and making sure that you're okay, and also you're not going to be asked to do something that you really don't feel happy in doing. So just general support and mentorship.
I think it's more about, and what we're doing now is much more collegiate working and trying to make it okay to say, I don't know about this.
Yes.
Totally.
Can I ask? And you're not expected to suddenly be an ITU nurse from nothing, from being completely different in a completely different environment. Actually, it's okay to say, well, actually, I don't know about this.
Yeah.
We were told about this in the training, but I didn't really catch that, and that's okay.
Yes.
And so therefore ask for help.
Yes.
And for people to be accepting of that and to be able to give that help.
Absolutely. I think if we can be kind and compassionate and patient with our colleagues, and definitely, like you say, know that it's okay to ask. There's no such thing as a silly question. People are feeling overwhelmed at the moment, and it's hard to kind of retain information when we're feeling very stressed and anxious. So being able to sort of have information repeated lots of times is normal. Yeah.
I think you touched on an interesting point I hadn't thought of before, which is about, in a lot of teams, yours as well as mine by the sound of it, the more senior staff are not being redeployed, but it's the more junior staff that are. And I wonder if, or I suspect that maybe that, again, adds to the anxiety, because the people they would usually look up to for the leadership that the leadership they're used to having, those people are staying behind and they're being redeployed, and now who's my leader? Who do I look to now for the direct support in a new environment? And that, I can imagine, is another source of anxiety of who is my new leader. Which I can imagine must be difficult for those people as well.
Yes, absolutely. People need a kind of, just like children and parents, staff need a sort of safe base where they can go to and have a sort of existing relationship with, and that's going to have to be done in quite a sort of sped up, truncated way. But again, I think if people can be providing environments that are supportive and patient, and really recognising the position that people are in, that's going to really help with that. Yeah.
I think one of the that's on our list here is the self-isolating, social isolating, and the confusion around that. And if you're self-isolating and living on your own, there's one set of rules, but if you share a house, and then it becomes another. And then when it comes to the end of your isolation, do you automatically come back to work? Do you need clearance? Or then in some cases, we've had members of staff who have been off for their 7 days and then developed a temperature and have to then self-isolate for another 7 days. And A, the clarity needed around that, the rules, and B, people feel terribly guilty because they can't be in work.
Yeah.
One of our colleagues rang up and said, well, I can do it, but actually you can't because you're isolating. But I feel well. I'm really pleased you feel well, but you still have to stay off for that period of time. And it's, I think, getting the clear message got and making our colleagues not feel guilty for not being here.
Yeah, absolutely.
Because they know, because of the group chats that we have, that people are doing extras and swapping shifts and doing this, and
Yes.
and they can't be part of that. And it's for perfectly valid reasons that they can't.
Yes.
They're following the rules, and so they should. So not feel guilty about it.
Yeah, absolutely. And I think it's a phrase that's been well used in this situation so far, but to remember it's a marathon and not a sprint, and there will be times when those colleagues who are in at the moment will be off sick, and so those colleagues who are sort of at home at the moment will be able to come in and replace that kind of work. So everyone can feel a part of this. But I really identify with those things that you were just saying. I think everyone wants to be really involved, and again it comes back to our value systems of kind of wanting to muck in and be helpful. And I wonder whether there are ways for people who might be at home who are self-isolating but are kind of fit to work, who can be tasked with other jobs that they can do remotely, because that is a really good way for them to A, support the work that's going on site, but also B, to feel helpful at this time.
So we have that some of the consultants are not coming into work, so they're working from home, and therefore they're doing things that they can do from home. So being involved in multidisciplinary meetings, reviewing angiography, looking at seeing all the new patients on telephone appointments as part of their clinic. So they're taking over most of the outpatient work now. So they're still contributing a lot. In fact, they're contributing maybe more than we are who are here. And so that's a really nice way of making sure that everyone is doing something towards the whole effort. But also I'm sure it's a great thing for them who are at home thinking, I'm actually doing something, this is great.
Yeah, for sure.
So
I think from my team that's we've got quite a few members of staff, maybe just to minimise the amount of people in the hospital. We've got people working from home, but also a few members of staff who perhaps are higher risk themselves, and so working from home is the safest thing for them. But I guess that's another question of how do we make sure that they still feel part of the team, and how do we make sure that they don't feel too isolated? Because I know whenever I've been at home for a period of time, it's difficult not to feel cut off from everybody. Have you got any sort of suggestions to how we can make sure that they stay included?
Yeah, I think that's such a good point. I think staying connected at this time is really important for people, and we're doing a similar thing in psychology, though, where there are some of us who are working on site and some people are working from home, and we use kind of video conferencing, things like different programs that are available that you can use to stay connected. And we do kind of morning huddles and then afternoon huddles where we're all linked in, and that's just a good way for people at home to be knowing what we're doing here, and if there's any tasks that we need to give to those people at home, we can do that as well. So I don't know whether that's something that could be used, but I think staying connected is a really important point.
Yeah, that's something that we've been fairly proactive on. I think the whole, like you say, using different technologies to sort of get a team huddle done at least once a day, and it really does make a difference. Using the technology for training and just for a little talk. There we go.
Yeah, and it's also just a way for us all to be checking in with each other. Like, that's what we've been doing. Is the first question is, how's everyone doing? Is everyone okay? And then we kind of get on to the sort of different tasks of what we're going to do that day. But I think it's just a good way for us all to be asking how we are. Yeah.
I think as well, what we must remember, these are really, in our working life, these are unprecedented times, and I think people are finding that the daily change, because there's tweaks to the way we work daily. There's a pathway that's been created, and then when the pathway is tested, further tweaks have to be made to the pathway. And I think people are finding, if you have a day off and you come back and it wasn't like that, and that's because of we are learning constantly, daily, as we're moving through this phase. That it's an ever-changing environment, and I think that's hard as well.
I think creates quite a bit of uncertainty and a bit of anxiety amongst the staff, because things, as you say, are changing every hour really sometimes. You know, plans are changing. How do we deal with these type of patients? How do we deal with these type of patients? When do we wear masks, PPE? All of those things can change so dramatically within, as you said, one day. And then that's quite difficult for all the staff. I think as a whole team we feel that.
And that can vary from it being you say a whole process of what do we do with this patient to smaller things. I left here on Monday and left Clinic 5 where I usually spend most of my a good deal of my time, and I walked in this morning and now I'm based in Clinic 1.
Because Clinic 5's not there
yesterday
anymore.
everything got, my colleagues moved everything while I was working from home. Where is everybody? Where should I go? What's going on? Where's the tea room? All of these little things which then just help to knock you off kilter a little bit even more.
And I think it's really important to remember that, again, it's okay to feel, sort of uncertain or kind of, I don't really know what's going on at the moment. I've kind of been having conversations with really senior members of staff who feel like their job has changed so much and things are changing so rapidly that it's hard to feel sort of productive or kind of that you can follow your normal working pattern, because all of that, like we're just talking about, is changing all the time. So I think, again, it's about going back to ask questions, get the updates, and not to feel like I should somehow just know automatically about what's going on because it's changing so rapidly. That would be impossible for any of us.
And which also applies to non-clinical staff, I think, as well.
Yes,
Because when you think about relationship with Serco at the moment, we're now so heavily reliant on Serco, and before we can move on, we have to have a major process done in the lab before we can move on, and that's something and they're also going through a massive change period on how they work as well. So it's pretty huge what we're working through on a daily basis. So.
Yeah.